Why don't you take it away, Chris? And thanks for joining us.
Well, thanks for the opportunity, Kerry. I appreciate it, not only to kind of highlight what my role is at the department and some of the issue areas I'm working on, but also to put myself out there as a resource for folks to call and to connect with any questions or concerns around our services and supports that we provide throughout the state. In way of some brief background on me, I've been working for state government for about 18 years now. I started my career working in the legislature. I was an aide for 3 different state representatives and ended my stint at the State House as a researcher for the Judiciary Committee. I then went on to be Director of Public Affairs for the state's Victim Service Agency. And I've been in this role at DDS for about 2 years. It'll be 2 years, actually, no, it'll be 3 years, I'm sorry, in October coming up. So it's been quite a ride. So with that, I figured I could go into some of what, some background on the ombudsman role. I mean, ultimately, what is an ombudsman? Traditionally, it's a position that really serves as an advocate for consumers when service issues arise, and that's very much kind of the core of my function at DDS. As Kerry alluded to, it's been quite some time since there's been a formal ombudsperson at the department. It's been roughly 20 years since the department has filled the position. And in that time, I would say a lot of the issues that were reported to central office were going to varying units and specialties within central office. So there was no real central repository for kind of the issues that were being reported or any actions that were being taken by central office on them. There was no formal way of really tracking the issues or trends that were being reported up to central office. And there was no real consistent presence on the many internal and external work groups that involve a lot of our consumers, a lot of community members, a lot of our providers, that are really charged with looking at kind of how we provide services throughout the state, and more importantly, how we can improve them to make them more accessible and to really evolve with the changing needs of not only our populations, but just kind of what's going on in terms of, you know, availability of technology or other issues. So that was really the impetus behind the commissioner wanting to reestablish the position, to really start not only tracking those things and reporting on them, but also having a point of contact for folks in central office to kind of report those issues to and to help triage them. Issues have been primarily reported by consumers. And I would say that it's mainly families of the individuals that we serve, but slides that I have later on will kind of break that out in more detail. I'm also contacted a lot by legislators who have constituents in their district that are DDS consumers. But I also connect with them on issues around our budget and other kind of policy initiatives that are in play that impact our populations that we're serving. Part of this work obviously involves working with our regional and area offices to triage a lot of these issues and with our provider networks, as well as other EHS. And when I say EHS, I mean Health and Human Service agencies. So like Mass Health, like the Department of Mental Health, Department of Children and Families, who also may be serving our consumers simultaneously. So it's really a holistic approach to kind of triaging some of these issues. As I alluded to, there were, prior to my starting, a lot of central office staff were kind of triaging issues depending on kind of the front door that these issues were reported to. That work largely continues with me. I work with primarily some of the positions that I'm working with, family support directors, our self-direction managers, transition coordinators, our autism directors and service coordinators, human rights coordinators, and our legal team, just to mention a few. And through this work, I mean, we're really all working on not only reporting and tracking these issues, but also looking at ways that we can recommend updating our systems or our service delivery models to really address some of the issues and trends that we're seeing. So the next couple of slides are going to be a breakout of who I get contacted by most often, as well as some of the issue areas. In the interest of full disclosure, I have to say some of this data is a bit outdated. It was really based off of 1 full year of my starting the role. A combination of issues, including COVID. I mean, we've all been working remotely at DDS since the public health emergency declaration in March. But we also had a massive flood at our central office, which did a lot of damage, including damaging our server. So it's been difficult to be able to access as well as to maintain our databases. So apologies for a bit of the outdated data here, but I will say that it's still pretty relevant in terms of a good reflection of the percentages of who those primary contact sources are and what these issues are. As you can see here, and I'm sorry if this is hard to read, but I've kind of broken out by percentages of who contacts me the most. Literally, as you can see here, legislators are a big part of that. And that's not so surprising. I mean, oftentimes the issues that are being reported up to central office are at a point where there may be an impasse or disagreement between the answers provided by our area and regional offices. So folks are kind of pushing up the issue to get some more involvement in finding a solution to those. Next are family members, as I mentioned. A lot of, I would say, parents more often, but I mean, everybody's situation is difficult. A lot of siblings, a lot of other family members are reaching out on behalf of the individuals. And then it kind of breaks down into state agencies. Again, we work closely with other EHS agencies that are also simultaneously serving our populations. So I'll get a lot of inquiries from folks about kind of where we're at with services and how we can better coordinate and collaborate. I also receive information from the secretary's ombudsperson on issues reported up to EHS, as well as to the governor's constituent office. And then that's followed by issues reported by our provider networks, as well as media. And one important data point on this that we continue to work on and improve is the small number of the actual individuals we're serving who reach out and use me as a resource. And we're really trying to figure out ways to better promote access to me, whether that's through our service coordinators with their caseloads and providers, also highlighting to individuals that I am a resource that they can draw upon and to report any issues or answer any questions. So that's one piece that's a little concerning, but one that we continue working to improve as we move on. Some of the primary issue areas that I've dealt with. So the biggest one on this list is really service delivery, and service delivery can really include a multitude of things. Some examples of that would be an individual or family member's difficulty in communicating or reaching with their area office or service coordinator. A lot of questions regarding the ISP process, what's involved, how they can inform it, and really have that document reflect what their needs and goals are. Requests for either residential programs or day programs for placement in particular programs that is pretty much an often thing that I get, as well as issues that folks may be having at those placements, whether that's with staff or their operations or otherwise. Lack of services is a piece that I also hear within kind of that service delivery issue. And I would say primarily that relates to our ASD only individuals. As folks know, ASD became, or autism became, an eligible disability in 2014. So it's certainly an area that we continue to strive to meet the varying and broad needs of that population. And also I would add to it really a need for crisis intervention services or intensive supports that are needed by families. And more often than not, these inquiries really surround difficulties that families experience in trying to access other supports from other primary agencies. A lot of the youth that we serve within our population, oftentimes there are issues with schools and the IEP process. And also in terms of accessing other in-home supports like ABA that may be funded and administered through insurance or Mass Health. So those are some examples of service delivery issues that I typically will get. The next reported issue area, the largest other reporting, are funding gaps. Again, this really applies largely to our ASD population, but it also has included transition age youth that may not be part of the turning 22 class, and also families who utilize self-direction models. A lot of questions around kind of not only the amount of their budget, but also newly established kind of caps and criteria that folks have to meet within those models. That has been a bit of a change over the past year. So getting a lot of inquiries about that. As I'm sure it's not a shocker to you guys, I get a lot of questions around our eligibility process, not only about the process, but also how determinations are being made. I would say also I hear a lot around DDS possibly expanding our eligibility criteria to include some developmental disabilities that currently aren't in our regulatory or statutes, or regulations or statutes, excuse me. And some examples, recent examples where some policy, some bills have been filed around, like fetal alcohol syndrome is a big one, where, you know, it's kind of a cliff effect for some of those folks when they turn adults. There's no real agency to take them on. So a lot of inquiries around DDS looking to expand our eligibility and what that would look like. Transportation issues are ones that I hear a lot about, and typically they're more around kind of inconsistency of services. More often than not, transportation is provided by Human Services Transportation, or HST, which is an agency within the Secretariat. So a lot of those issues are funneled up to them. But I will say, in regards to transportation, I think an evolution has been an interest in looking at alternative modes of transportation that could be made accessible to our populations, like utilizing rideshare programs like Uber or Lyft. And in fact, there are a couple of pilot programs that are ongoing in our Southeast region that look a little bit different in each pilot, but essentially it's bringing together community members and linking up with those rideshare programs to really make those services accessible and safe for our populations. And it's been proven to be a great thing to look at in terms of flexibility around transportation when you're looking at varying work schedules, or if somebody's on, you know, non-existent transportation route, that those solutions have worked well for some. So I will say that in terms of transportation is probably going to be an issue that we'll be working on moving forward. Insurance issues and issues with mass health are often reported up to me. These can really range and vary. A lot of times it could be, you know, difficulty in obtaining medical equipment or coverage for that, getting some in-home service hours like PCAs, and difficulty in getting that. But also there's been a lot of exploration of looking at varying insurance options like managed care plans. That can be overwhelming for a lot of families to deal with. And at times mass health systems are maybe not as responsive as they would hope to be. So I assist in some of those issues as well. And then finally, I just wanted to add guardianship too. Guardianship comes up in varying ways. A lot of questions around, you know, when is guardianship needed? What is the process that it takes to appoint a guardian? But I'd also say that I hear from family members who may have had guardianship removed to not only talk about their disagreements around that, but also how they can best work with that appointed guardian, or who the guardian is moving forward. That's been an issue. And I would say too, around guardianship, I mean, it's kind of an evolving piece with initiatives like supported decision-making that are out in the legislature right now, that could create other options around kind of guardianship for folks. That will certainly be a focus of my role and DDS's central office, and looking at how that's going to play out if it is enacted at some point. So I wanted to just include this slide to give folks a sense of kind of what some of those work groups are that I mentioned earlier that do look at kind of our services and how we're delivering them, but also our venues for not only our consumers, but also providers and community members to report any issues or ask questions. I won't spend much time on this slide, but because I've mentioned that there are a number of groups, I wanted to just throw that out on a slide for folks to look at. I'm happy to answer questions if folks want to dive in a little bit more into some of these groups. But I certainly would be remiss if I didn't highlight that I participate with Kerry on the ARC's Assistive Technology Task Force, which is just a great example of one of those work groups that are looking at kind of evolving and changing needs, in this case around technology, but how DDS can collaborate with our partner agencies to really improve access and kind of meet the evolving needs of our service populations moving forward. But that's one of several that I participate on. I also wanted to note that in addition to being Ombudsman, I'm also the legislative director for DDS. So I just wanted to, and again, I won't spend much time on this, but just wanted to highlight some of the primary policy areas that DDS has been engaged in over the past legislative session. Our engagement is largely more of kind of an informative educator kind of role. It's not really taking a for or against position. As you know, DDS is within the Secretariat, so we work in concert with the Governor's office as well as with Secretary Sutter's staff in responding to any legislative inquiries or kind of weighing in on how they'll impact our systems. But these are just some of the pieces that I've worked on. I also wanted to highlight the fact that DDS submits a number of legislative reports annually. And those reports are really kind of overviews of how we are allocating state funding, federal funding, as well as how we are putting out our service delivery models and some statistics and outcomes, that we see annually in that. All of those reports are available on our website and can be accessed by the public. So if you're so interested in some of those, I would direct you to mass.gov/DDS to take a look at some of those. But again, I mean, there's just a number of policy initiatives that have come across. I mean, most notably the passage of the Abuse Registry, or Nikki's Law, which has really created an augmented system for us to not only report on abuse, but also track abusers to make sure that they are not kind of cycling through different agencies within our systems. So there's a lot of work on that front that still continues. And then finally, I just wanted to give everybody my contact information. Please contact me. Here's my email and my cell phone number. As I mentioned, we're all still very much working remotely due to COVID, but also due to repairs from the flood. But use me as a resource. I mean, any questions, any concerns that you have around how DDS is supporting our consumers or how we're putting out service delivery models, it's always helpful to hear from folks and is largely reported up. I mean, your feedback and input is certainly considered in all of these facets and is really used as a tool to help improve how it is we're serving folks. So with that, I can open it up to questions, Kerry.
Okay, great. Thanks. Thanks, Chris. That was a good overview. You've got a very busy job there. So Jossie had a question. Do people contact you for questions and clarifications, or only when there's a problem?
Both. I would say when, and it kind of depends on the situation, but our systems are pretty complex at times. So whenever there are funding issues or eligibility issues that may be explained by the area office, oftentimes it takes folks some time to digest and process that, and they may have other questions, and they may want to bring that to a third party, not necessarily the area office. So I get some of those questions. More often than not, though, I am getting kind of the problem areas where there are just disagreements or maybe a misunderstanding over why DDS is taking a particular stance or made a particular decision. So I would say that I hear on both levels.
Okay, thank you. And then has a couple of questions. What is the process and timelines for resolution when a problem or question was brought to your attention? And then for a second part of the question is, for families whose English is not their first language, can they write you in their native language, and or is there any dedicated line that diverse families can reach out to you directly for questions or problems?
Sure. I'll probably take the second question first in terms of accessibility. We do have access to the language line. So anybody can call me directly and let me know what is their preferred language, and we can connect via that way. They can always send me written correspondence in their language, which I can get translated and then respond. Usually over the phone, we'll utilize that language line to effectively communicate with folks. But in terms of kind of timelines, it's really situational. I mean, everybody's situation is very individualistic and has its own set of kind of layers and factors in it that, you know, may influence how long it takes to triage a problem. You know, and I'm getting a wide range of issues. I mean, if it's an issue around, you know, a group home having to take better accountability of how an individual's private funds are being used, you know, that's maybe not such a complex issue as, you know, somebody wanting to move their individual from one group home to maybe closer to where they live in the state, which includes an area of tie change and finding an appropriate provider and another placement for them. So there's no established timeline for these issues because they're so individualistic, but I can tell you we try to work our damnedest to get it resolved as quickly and efficiently as possible.
Thanks, Chris. Okay, and Lucy was wondering, what issues have you been best able to solve, and what are the issues that are most difficult?
What was the first part of that question, Kerry? I couldn't really hear that. I'm sorry.
Oh, okay. What issues have you been able to best been able to solve?
Well,
easiest to solve, yeah.
That's actually a tough question. I would say more often than not, when there isn't a resolution to a problem, it's usually due to either communication breakdowns from our end, or things not being explained properly enough that interceding on that level has been helpful for a lot of folks. And again, to have that kind of external party outside of their area office or their direct service provider, I think has been helpful for folks. In terms of kind of what issues have been the easiest to resolve, I don't know if I can really quantify that easily. I mean, again, with each issue comes its own individual set of factors. I think one of the most, maybe I'll take it from this respect, I think some of the more challenging issues that I've dealt with have really been around our services for ASD folks. I think it's one area that we are consistently trying to evolve in, that we're trying to understand more and build capacity to respond to. So when there are issues of lack of funding, because particularly for that crew, a lot of the funding is derived from state dollars. And if we have any reductions, or even if we're level funded, it's difficult to try to get creative or to provide much of anything to those folks. So I'd say those are probably my most challenging cases. But I'd also add eligibility in there too. I mean, there are a lot of folks with conditions that don't neatly fit into whether it be DDS or other EHS agencies. So listening to kind of those stories and trying to piece together some, you know, patchwork of services, whether it be through DDS or otherwise, for those folks has been really challenging too, to try to initiate. And it's also difficult to try to project how expanding any eligibility, you know, whether it be through service delivery capacity, whether it be through funding, is difficult to project, but even more difficult to push for. So that's been challenging too, in some respects. I hope that answered some of the question.
Okay, thank you. And Jean was wondering, given the recent pandemic and non-mandate for testing of staff. Have you addressed issues of staff, not only state agency, but provider agencies too, working in multiple homes? Is there anything being done by the DDS to address these concerns?
Sure. The issue of mandatory staff testing is one that is very much under review by the COVID Command Center, by the Baker administration and EHS. So that broader issue is a little above my pay grade and is something that's still being worked on. But in terms of our response to it, I would say largely we're not finding that staff are refusing testing. And we've made mobile testing available to our group homes, as well as pop-up testing sites throughout the state for staff who either may not be available or on shift when Fallon mobile testing comes to the group home, or if they just are too busy at the time to do it, they can go to pop-up testing sites. We've had great responses to that. I think at this point, and I'm sorry, I don't know the numbers off the top of my head, but around 14,000 staff, I think, have been tested at this point. We have operational guidance that's very stringent and clear around the ability of staff. So if staff are working with COVID positive patients, they are kind of sequestered from the rest of the staff. Our Congregate care guidance, which is available on our website as well, that outlines kind of all of those rules and operational procedures for staff. Again, are really designed to make sure that they are utilizing PPE, to make sure that if once they're coming into work, that they're being screened, that if they're meeting any of kind of the conditions of possibly, or any of the symptoms of COVID, that they are not allowed to start work and they have to quarantine for 14 days. Before returning to work. So, in the absence of mandatory staff testing, between our Congregate care guidance and just making testing available to all that, want to utilize it, that's really how we've been able to kind of approach and address that issue, which is a significant one. I mean, the COVID pandemic is something that our system has never really experienced before. And there was never really any kind of situation where we would have to mandatory test staff for viruses. So this is all new territory that is still evolving and is a very fluid thing. And I think as things progress and continue, there will be further news on that. But our Congregate care guidance and a lot of the rules that we put out for staff regarding COVID operations have been primarily how we've dealt with this.
Okay, great. Thanks, Chris. And Vicki was chatted in that her son gets DDS services due to an intellectual disability, and he's a Section 8 housing voucher, and they've been given an accommodation to seek congregate housing. Is that something that she can expect DDS to help her with?
Absolutely. I mean, she should be in connection with her child service coordinator. They can assist in pulling all of that together, but they may also be able to assist in terms of, I'm assuming the individual is able to live independently if it's Section 8 housing, which is fantastic. But we should be a partner too, in terms of not only maybe helping to find housing, but also what supports that we can have in that home to ensure that individual is able to maintain his independence and has adequate supports to be able to do that.
Okay, thanks. And On was wondering if we've combined all the problems and the issues to track patterns and come up with proactive plan to potentially prevent these to happen again.
I'm sorry, could you read that question again?
Sure. So wondering if you've combined all of the problems and the issues to track patterns and come up with some proactive plans to potentially prevent these from happening again.
Yeah, so I think that's an ongoing process that we continue to do. I think COVID has been a big hiccup in many ways in that respect, particularly in terms of maintaining a database to be able to track those trends more often than not. I think some of what the slide has, let's see if I can go back to it, of course not. But some of the main, I know you're sending this out to everybody, Kerry, but some of the main issue areas that are reported are the primary trends that have been reported to me thus far. And working with central office staff as well as our local and regional staff, and with all of those work groups that I had highlighted too, I mean, that's really a way that we continue to try to not only monitor what those trends are, but to figure out solutions on how to deal with those. And if that person has any, suggestions or one priority area in mind that I may not have covered, I mean, again, please reach out to me and happy to talk more about things in detail.
Okay, and I think we have one time for one last question. Lucy was wondering, what's the reason that staff providers are not required to test for COVID?
I don't have the full answer to that. Again, it's an issue that is being dealt with by the COVID Command Center and by the Baker administration. I mean, I know layers of it include, contracts and unions, the fact that there has never really been a requirement in our system ever for that is something that I think our legal teams have looked at. Those are just pieces to the larger story. I don't really have a full answer for you, unfortunately. But that's something that, really should be directed up to the governor's office, because they are looking at that and have continued looking at it, since the pandemic has really hit.
Okay, thanks. All right, so that was a great presentation, Chris. You're a wealth of information, and it's so nice to know that people can have direct access to somebody at DDS when there's problems and issues. So I want to thank you for taking the time today to spend with us, and also thank all of you who joined in today. And I'll be sending out the slides, and you can see that Chris's email and his cell phone are both on here. So don't hesitate to give him a call, and it's good to have a voice at that central office. So thank you all. Hope you all have a great day, and very, very helpful. Lots of people chatting in, thank you, and just good information. So, all right, have a great day, everyone.
You too. Thanks.
Be safe.
Bye-bye.
Bye-bye.
Thank you.